Hi, everybody. Linda Pellegrino back with you here on Senior Radio Buffalo, where we're always looking to give you information and to educate you on all of the subjects that involve us seniors. We're seniors at a lot of different generations right now. I'm in my 60s. We have people listening who are 70s and 80s plus, and everybody seems to have different needs. But the one thing we all need is to know what's going on in our community and to all be connected. So when we need special services, we know where to pick up the phone. We're talking to some new folks who are on with us at Senior Radio, some folks from Absolut Care at Aurora Park. Did you know they are under a new ownership? And let me tell you, the people they have brought on really want to talk to you about what their new goals are. So let's say good morning to Stacey Bastian. She's an RN and administrator at Aurora Park, and Dr. Paul Shields. He is with Great Lakes Health System and General Physician PC, also the new medical director at Aurora Park. So hello, folks. Nice to have you on.
Hi, thank you.
Hi, thank you.
Stacey and Dr. Shields, this is interesting because you literally both started as certified nursing assistants back in the day before you've come to this point. Stacey, maybe you can explain how this helps you both with communication.
Well, a certified nursing assistant, in my opinion, is the backbone of any successful unit, providing care to individuals because they spend the most time with the residents that they service. That being said, starting our careers, taking that pathway gives you an empathy and understanding of the importance of their role. And it bridges the gap of communication so that, if there are subtle changes that are occurring with the residents, typically the certified nursing assistant is going to be the first one to pick up on it. So it's just educating the staff. It's a change of culture. It's an appreciation for every level of individual that services the residents here at our facility.
Now, Dr. Shields, again, congratulations. You are the new medical director at Aurora Park. How does this in your past help you move forward now with your team to optimize the patient experience?
Yeah, so having lived it and experienced it, we've directed our team to take a very directed approach to patient changes and involvement with the certified nurses and aides, as well as the CART nurses, the nurses who are in direct care with the patient. And what we've identified is that patients who have any change in their clinical condition, it's almost always identified first by the direct care staff. And what we want to do is optimize that level of communication, have the nurses' aides as well as the nurses have a direct line of communication with our treatment team, and also to empower them and to engage them to provide creative solutions when patients are identified and having changes. And while that sounds like a kind of a common sense approach, that has not necessarily been the approach in skilled nursing. There's been a hierarchical level of communication. The electronic health records have muddied the waters somewhat in patients believing that in providers believing that when they enter something into the electronic medical record, that has been communicated. And what we know is that's not the case, and that it needs to be direct communication. And as we focus on that and empower the staff to practice to the level of their license and training, we get better communication and patients get better care. So having been there and been an aide and helping patients and working my way through undergrad and medical school, it gives me a kind of a sense of support for those frontline workers to engage them to provide what they need to give to the clinical providers. It gives us a tool to be able to manage patients better. The nurses' aides know the patients, frankly, better. They know their families. They know the patient's history. They're able to provide a real history, and when we simply ask them for their input, that goes a long way to improving patient care.
All right, and we're speaking with Dr. Paul Shields. He is the new medical director at Absolut Care at Aurora Park, and Stacey Bastian is an RN, and she's administrator at Aurora Park. And I want to let you know where it is. It's right on Main Street in East Aurora, and if you would like to get in touch, 652-1560, 652-1560. Website is absolutcare.com. absolutcare.com. And as they're talking, it's hitting me that it's kind of a new opportunity for excellence at Absolut Care at Aurora Park. So, Stacey, if you are now the new administrator, maybe you can explain why you decided to join the team.
When I was approached with this opportunity back in March, it was without hesitation that I decided to come on board. I had previously worked for the owners in one of their other outfits, and the support that they provided, their commitment to excellence, their proficiency with policies and procedures, they're innovators in healthcare, and I knew coming to Aurora Park I would have all the support I need to promote success.
That's fantastic. So it does sound like you folks are there to really let people know you have some real goals in mind, and you're really looking forward to bringing Absolut Care at Aurora Park up to the standards that you're shooting for.
Absolutely, and it's pretty simple. It's excellent care simply because the residents deserve it. My expectation is for the people here to receive care as if it's family. It's not difficult. It's simply what they deserve. And we have a wonderful team here working that is fully supported, not only by the new ownership, but by Dr. Shields and his team. And we couldn't be happier. We're making a lot of positive changes here.
And Dr. Shields, you come with an awful lot of experience. Not only did you start out as a certified nursing assistant, but in your role as a doctor, you have been very busy with community involvement. For example, the COVID task force with Kaleida Health, director of the Visiting Nurse Association of Western New York. And all of this experience benefits the residents at Aurora Park.
Yeah, absolutely. We like to believe that we provide a continuity of care that allows patients to move efficiently to where they choose to receive their care in that least restrictive level, be that at home or in a long-term nursing facility. And by having engagement with the community providers that provide that care at different levels, we're able to standardize the care and also make sure that the care and communication is most efficient. So having a seat at the table at the hospitals as well as with VNA of Western New York, it allows us to make sure that we're responsible for the care within the subacute facility and also picking up the care from the hospital and transitioning it back to the community. And we believe that as we move that forward in that streamlined process, overarching the care as they move through the continuum, we'll be able to optimize the care that patients receive.
And I know that transparency is very important. It's a goal for the new Aurora Park. And Stacey, I know you're going to be hosting new town hall meetings, and maybe you can tell us about the philosophy behind that.
So coming in here, communication is key, and being transparent and having that dialogue with the families of the residents we service is huge. Unfortunately, due to COVID and the restrictions that we're all facing, and in an effort to keep everybody safe and prevent the spread, we've transitioned to a Zoom platform where we have routine Zoom meetings, not only with the family members, but as well as the community of East Aurora, just to keep the communication flowing regarding changes here at the facility, the status of the facility, new goals, new projects that we're working on. Transparency, honesty, it's important, and it will bridge the gap and mend the fences of what was broken in the past and show, everyone that this isn't the company that it was before. And, we're very excited and very proud and committed to excellence.
This is Stacey Bastian, who is an RN and new administrator at Absolut Care at Aurora Park, and Dr. Paul Shields. He is the new medical director at Aurora Park. So it's really great to have you both on. And as a matter of fact, Stacey, improvements have already been made at the facility. Maybe you can tell us a little about that.
Absolutely. So we have our gym for our rehab residents that has been newly renovated. It's over 3,000 square feet, and areas in the gym mimic areas that people will need to rehab so that they can be successful at home, building on skills in the kitchen, in the bathroom, on stairs, where we can have our highly trained staff work directly one-on-one with the residents to practice these skills, again, so that they're successful at home. In addition, we have a dialysis den where we offer in-house dialysis services to the residents here at the facility. More importantly than ever, with the pandemic and the restrictions in the community and the prevalence of the virus, it comes in perfect timing to have individuals that need dialysis service to stay here in the comfort of the facility where they are not risking potential exposures. We've also remodeled our dementia units with new flooring and fresh paint, again, to provide a home-like environment so that the residents are comfortable in their living quarters.
That's fantastic. And everybody, again, we're talking about that there is new ownership for Absolut Care and Aurora Park. Stacey Bastian is the new administrator at Aurora Park. She's also an RN. And Dr. Paul Shields from Great Lakes Health System and General Physician PC, he's also the new medical director at Aurora Park. So they're looking for a new opportunity for excellence. And it sounds like that's what they've got in mind, and that's how they're going to approach everything. Overview of the programs offered real fast, just like Stacey said: long-term skilled nursing care, short-term rehabilitation, dialysis, memory care, and complex care needs. And doctor, very quickly, I know that with your team, you can really, really bring great change to this place. Your wonderful team at General Physician PC is looking forward to bring your staff over to meet the residents and families of Aurora Park and get to work.
Absolutely. We're excited. We think it's a good partnership. We have very common vision for improving the space. And, I think that one of the things that we like to stress is this is not about somewhere where people have identified a problem. We've identified good partners that we feel we can come in and capitalize on the good work they're doing and do it even better. One of the tenets of total quality improvement and continuous quality improvement is identifying that what you're doing is good, but you can always do better. And we believe at Absolut Aurora Park, we have a good partner in that. And it's a common vision to improve the care for patients, and we're very excited to keep that moving forward.
Dr. Paul Shields, thank you very much. Stacey Bastian, good luck with Absolut Care at Aurora Park. We're very, very happy to speak with you on Senior Radio Buffalo. For those who are looking for the information, give them a call at 652-1560, 652-1560, or their website is simply absolutcare.com.